to Breakfast with Spaniels with Dr. Judy Morgan.
Denise Gaspard Benson, first one on. Yay, notification. That is a big yay.
Remember,
Bermuda.
You can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Well, good morning. Facebook might... Oh, I pronounced it right. Okay. Raining in I don't know where that is. It cut it off. I guess I can click on it. Anyway, we're supposed to get the storm coming through here later today and all day tomorrow, which will drop the temperature, which will be lovely. Yesterday was just kind of not fun from start to finish. I got stung by a bee emptying a manure bucket, which I really despise anything that stings. And we've got a wasp nest in the rafters in the barn, which none of us have been brave enough to spray. But I'm really afraid of them. So our little Jasmin donkey, by the time the equine vets are so busy, and by the time they got out there, it was 2:00 in the afternoon, and she was not doing well at all. So they didn't have a whole lot to offer, and they said, well, we think that she should be shipped to the university. And I said, well, I'll go for that, because we got to do something. And so we got her to the university. By the time I got Brandon and Gwen out to the farm, we needed their truck to pull the trailer. So Brandon was kind enough to drop everything and come over and go with me to take her to the university. And we got her admitted, probably 5:30 or so. And they scoped her and did an ultrasound of her chest and all kinds of things. And yes, she has a very severe pneumonia. And when they put the scope down her airway, they actually saw food material down there. So we've had something going around the farm, some upper respiratory thing for a while that we're just having a hard time getting rid of. As soon as one gets better, the next one starts coughing and blowing snot. So not real antibiotic responsive. So I think we may have a viral part there. But it looks like at some point she choked and aspirated some of her hay. And that was sitting down in her airway, festering, and that what caused the problem. So we did get cultures before we started antibiotics, and they are also doing viral PCRs, because we really need to know what we're dealing with, just in case somebody else on the farm blows up with something. So it's really important, and we had this discussion a couple of weeks ago when Gwen took her dad's cat in with a urinary tract infection, that she wanted to wait for the culture before she treated the cat with antibiotics. And we got a little pushback on that. Some people were like, oh my gosh, the animal is suffering while you're not treating it. You should just start it on a broad spectrum antibiotic and not wait for the culture to come back. Well, you know what? That is a judgment call every single time. And we're going to talk more about that later in the week. That is a little bit of our focus this week. But the antibiotic that was given to our donkeys when they originally came, because they were all blowing snot, was a product called Exceed, which is an injection that lasts 4 days. It's horses, equines only. And so they get 2 injections 4 days apart. And it worked really well on the first go round. And then I don't know, a month or so later, we had the minis and the hinnies started to blow nasty looking stuff. So we had the vets come out and they gave them Exceed again, and it did nothing. So either we have something resistant or there's a underlying viral component that isn't going to respond to antibiotics. And you basically, we started everybody on quercetin and bromelain and echinacea, astragalus. Um, CoQ10, probiotics, colostrum. So they're on a bunch of supplements, and finally the minis and hinnies seem to be clearing up. But then yesterday, well, night before last, Monday night, Jasmin started breathing really hard and just proceeded to get worse. And of course, it's been 95 and humid and feeling like it's 110. So not good for her. So, and if she does have an aspiration pneumonia, then that's a totally different ball game than what we have spreading around the farm. But we do need to know what we have. So we did make sure that they got their viral PCRs and their cultures from deep down in her trachea and in something called the guttural pouch, which kind of is in the back of the throat in horses. And we'll have those cultures back in a few days. But in the meantime, she was so sick, temperature of 104, normal for them is about 99 and a half. She's so sick that we had to start her on broad spectrum antibiotics. So she is on penicillin. Anybody remember penicillin? Nobody uses it anymore. Penicillin, gentamicin, which is very hard on the kidneys, so that's not something that you use lightly, but we're in a bad position with her right now. We used to use it more in small animals. It is used very rarely now. It's used in topical, like ear products and stuff. Because we're looking at getting two different classes of bacteria, gram positives and gram negatives, for those of you who do the microbiology thing. So, and then they're also adding metronidazole. And the reason they're adding metronidazole is because her lungs look so bad on the ultrasound, and metronidazole will kill anaerobic bacteria, which are bacteria that hide in pockets where there's no oxygen. I know it sounds a little bit weird to say there's no oxygen in the lungs, but there's pockets and you get these abscesses potentially. So how do we avoid the aspiration? Well, we're going to have discussions about that. She might end up having, and this is very strange for a young animal, but a few weeks ago, there was a period of about 5 minutes where I actually wondered if she was choking. But normally, if they're choking, it basically means they get something balled up in their esophagus and it's not going down and they've got an obstruction. And so they'll start getting reflux out through their nose. And she didn't have that, but she was extending her head doing this kind of weird gulpy thing. And so I palpated along there and I kind of massaged along her esophagus. We fed her some grass and carrots and she swallowed them fine. So I thought, okay, I don't really, like, she wasn't in distress, so she didn't have all the signs of a choke. So it was weird, but now that we're sitting in this position 3 weeks later, I'm thinking maybe she really did have a choke and managed to aspirate something while she was clearing that on her own. So she's actually on 3 different antibiotics, but when we get our cultures back, that will tell us if we've got something that's resistant to that or if we need to make a change. So you do what you have to do. If we waited 3 more days to get antibiotics on board for this poor little thing, she would be dead. Right now, her prognosis is guarded no matter what we do. She's in air conditioning in an isolation ward on oxygen, which that in itself is really helpful for her. And I will get an update probably around 9:30 this morning. So that's where we are with that. There's always something, especially when you do rescue animal work. But this morning, actually, I decided this yesterday, but I thought, these Project Sudz bars that I have been bathing the dogs with, I think are the coolest thing ever. And Janine Ling, who designed them, always tests everything on herself first. So she made all of her friends use her products to, bathe and wash their hair and stuff before she released it, and said, I wanted good feedback from everyone. I wanted them to use it on themselves and their animals. I've been using it on the animals. So one of the things that I have frizzy hair, clearly, because you guys have seen me when the supporters last night. It was like, it's humid, it's hot. I have really curly hair, and so it just does its thing, which is why I don't cut it short because it would just be. Um, so I've been using all these shampoos and conditioners that are really heavy, really thick. And they leave like a film on your hair, but it does kind of weigh it down and help it sit still. So I thought, well, you know what? I'm gonna try Janine's stuff. And so this morning I bathed with the lavender, clary sage, and bentonite clay shampoo bar and washed my hair with it. Now, immediately when I was rinsing my hair no longer had a film on it. It was like squeaky clean. Like there really is a squeaky clean. And it took all of that buildup of, because I think it's the apple cider vinegar that's in there, but it took all that buildup off of my hair. And so then I thought, well, okay, I need a conditioner. So I used the conditioner bar. And I have to tell you, my hair actually feels the cleanest it has ever felt. It is amazing. So we'll see how the frizzy does over the next. Janine's girlfriend has this kind of hair. I haven't talked to her about. I'm sure she's using the products. Janine has long straight hair, so no biggie. But we'll see how my hair does because we've got this humidity with this storm coming through. But I have to tell you, my hair feels the cleanest I think it has ever felt. Really amazing. So I'm kind of thinking that when we use up all of the bottles of shampoo and conditioner, because I tend to buy in bulk, once those are gone, I'm going to this. And Janine is actually, for our new house, she's private labeling personal size bath bars and shampoos for our farm, for our guest bathrooms. And really excited about that because we just think it'll be fun when guests come. They get their own private labeled products that we stand behind and really approve of. And I thought, well, if I'm using it in the guest room for the guests, why am I not using it for me? So I can't wait to use up all this stuff, and then I'll have her make a whole bunch for us as well. So kind of fun and exciting. It is kind of one of those things, like everything that we're willing to use on our animals, we should try on ourselves first. I'm going to agree with that. If it's not good enough for me, it's not good enough for them. So there we go. You have so much humidity here. You have Monica in Barbados hair. Yeah, well, that's mine too. So let's see if I can get some music. Come on. Oh, gosh. Really, is today going to be... Today can't be yesterday. Man, oh man. I can't take another yesterday. It was a long day yesterday. Long day. Frizz updates, I know. Hey, if you didn't see it, we posted a survey yesterday to see what kind of pets everybody has and what kind of information people are looking for. And the second, Gwen made the survey, so I hadn't seen it. The second one, it said, what species would you like to have more information on or learn about? And she actually included people in that list, and I thought that was pretty cool. Because I think there's so much we could learn for ourselves as well. So, do you want people information as well? We could do a human summit. We're doing a cat summit. We're eventually going to do a horse summit. You want a people summit? You want a bird summit? We'll go out and find the experts. Will they sell that to others? Yes, she'll private label, and she sells to a lot of Airbnbs. She said she's been private labeling for those. So yeah, check it out. Might be kind of fun. All right, everybody have a great day. Gotta go take care.